What if I told you that 5 leaves everyone calls miracle cures might actually be putting your health at serious risk? Maybe you've tried peppermint tea for digestion or moringa for energy, assuming they're completely harmless because they're natural. But here's what they're not telling you. In certain cases, and with specific medications, common herbs may cause real risks that could strain your kidneys, disrupt blood clotting, or send your blood pressure dangerously low. I'm going to reveal the hidden dangers that other health channels won't discuss because it doesn't sell products. The truth is, some of these popular remedies can land you in the hospital if you're not careful. Let's start with one that might shock you. Peppermint might seem like the most innocent herb you could choose. After all, it's in gum, toothpaste, and candy. But when you're over 65 and taking heart medications, peppermint becomes a concern that most doctors never mention. The menthol in peppermint doesn't just create that cooling sensation. Any herb that affects digestion or circulation could theoretically interact with medications, so caution is wise. Here's what you need to understand. Peppermint contains compounds that might influence how your body processes certain medications. When you drink strong peppermint tea or take concentrated peppermint supplements, these effects could be more pronounced. Your medications might work differently than expected. The result could be unexpected changes in how you feel or how your body responds to treatment. The truth is, peppermint can mask warning signs when something isn't right. You feel that cooling, soothing sensation and think your discomfort is getting better. Meanwhile, you might not notice other changes happening in your body. The peppermint tricks you into feeling calm while potentially affecting how your medications work. Many seniors mistake this false sense of relief for actual improvement. Some seniors taking multiple heart medications report changes in their readings after adding strong concentrated forms of peppermint. Always check with your physician before combining any herb with prescription drugs. Even moderate amounts of peppermint in supplement form can be more potent than a cup of tea, so dosage matters more than you might think. If you notice unexpected dizziness, unusual heart rate changes, or sudden fatigue after adding peppermint, pause and talk to your doctor. Many people ignore these symptoms because they develop gradually over several days or weeks. The connection between the herb and the symptoms isn't always obvious. Here's the most concerning part. People over 65 process medications differently than younger adults. Your liver and kidneys work slower. This means any herb's effects could last longer in your system. What might be a minor concern for a 40-year-old becomes a more serious consideration for someone your age. The belief that natural equals safe can be misleading when you're on multiple medications. The reality is clear. For seniors taking heart medications, that innocent cup of peppermint tea requires more thought than you might expect. The potential for interactions, even if rare, means consulting your doctor first is the smart choice. Any digestive comfort the herb might provide isn't worth the risk of unexpected medication changes. But peppermint isn't the only so-called superfood that health-conscious seniors need to think twice about. Moringa powder sits on health store shelves with labels promising everything from energy boosts to disease prevention. Social media influencers call it the miracle tree that can cure diabetes and heart disease. But here's what they don't tell you about this so-called superfood. Some seniors with reduced kidney function have reported rising potassium levels after daily high-dose moringa supplements. If you have any kidney concerns, talk to your doctor before trying moringa. Your kidneys naturally lose function as you get older. Moringa contains compounds that can overwhelm kidneys that are already working harder because of your age. Adding moringa to the mix can push them over the edge when they're already struggling. The potassium content in moringa is where things get serious. Moringa leaves are naturally high in potassium, about 300 milligrams per tablespoon. That might not sound like much, but seniors with kidney disease can't process potassium properly. When potassium builds up in your blood, it affects your heart rhythm. Your heart can literally stop beating normally. This is especially dangerous if you take ACE inhibitors or potassium-sparing diuretics. These common blood pressure medications already raise your potassium levels. Seniors on these medications should be particularly cautious. Everyone praises moringa's high protein content. What they don't mention is how that protein can add strain on aging kidneys. Your kidneys have to filter waste products from protein breakdown. When you're over 65, your kidneys are already working at reduced capacity. Adding extra protein from moringa forces them to work even harder. This accelerates kidney damage that might take years to become obvious. Moringa also contains natural compounds that might contribute to stone risk in sensitive individuals. Stay hydrated and discuss it with your doctor if you have a history of kidney stones. If you have diabetes, moringa creates another serious problem. Moringa may enhance blood sugar lowering effects, so if you take diabetes medications, monitor your levels closely. Your glucose might drop too low or spike too high. Both situations can be dangerous. High-dose moringa extracts can overwork your liver over time, so moderate whole leaf amounts are safer than megadoses in capsules. Your liver has to process all the active compounds in these concentrated doses. This can cause inflammation and damage that builds up over time. Small amounts of moringa leaves in food are different from the megadoses packed into supplements. Health influencers often recommend doses that are 10 times higher than what's actually safe. They suggest multiple tablespoons of powder or several capsules daily. These amounts can cause serious organ damage in aging bodies. Watch for early warning signs that people mistake for detox symptoms. Fatigue that gets worse instead of better. Nausea that doesn't go away. Digestive problems that persist. These aren't signs that moringa is working. They're signals that your body is struggling to process toxic levels. The reality is harsh but necessary to understand. What's marketed as nature's perfect supplement can create serious problems for seniors. But moringa isn't the only popular health drink that poses hidden dangers for older adults. Green tea sits in millions of kitchen cabinets, praised by health experts as the ultimate antioxidant drink. Green tea contains vitamin K, which can counteract blood thinners. If you take warfarin or similar medications, discuss your green tea intake with your healthcare provider. Every health article praises green tea as heart healthy. They talk about antioxidants and longevity benefits. But if you're on blood thinners like warfarin or apixaban, green tea becomes a concern that most doctors don't think to mention. The marketing never mentions how this seemingly innocent beverage can interfere with medications that seniors depend on to prevent dangerous clots. The problem starts with vitamin K in green tea leaves. Your blood thinner works by blocking vitamin K, which your body needs for clotting. When you drink green tea, you're adding vitamin K back into your system. This directly fights against your medication. Your carefully balanced blood thinner dose becomes unreliable. Sometimes your blood gets too thin, causing bleeding problems. Other times, the vitamin K overpowers your medication, raising your risk of clots. The amount of vitamin K varies depending on how you prepare your green tea. Stronger brews contain more vitamin K. Multiple cups throughout the day add up quickly. Your doctor calculated your blood thinner dose based on your normal diet. Adding several cups of green tea daily changes that equation completely. High-dose green tea extracts have raised concerns in some reports, so use supplements judiciously. These extracts contain levels of active compounds that can be unpredictable. The same dose might affect you differently from day to day. Your blood thinner becomes harder to manage when you add these concentrated supplements to the mix. Even decaffeinated green tea isn't necessarily safe if you take blood thinners. Removing caffeine doesn't eliminate the vitamin K or other compounds that interfere with your medication. The blood clotting effects remain. Many seniors switch to decaf, thinking they've solved the problem, only to discover the interaction continues. Watch for new bruises, nosebleeds, or dark stools. These could signal clotting issues when you mix green tea with blood thinners. Most people dismiss these signs as normal aging. But when you're on blood-thinning medications, any unusual bleeding deserves immediate attention. The timing of your green tea matters too. Drinking it close to when you take your blood thinner can create stronger interactions. Spacing them apart might reduce the problem, but it doesn't eliminate the risk completely. The vitamin K stays in your system for hours after you drink the tea. Your blood thinner keeps you alive by preventing dangerous clots. Don't let a healthy habit undermine this critical medication. But green tea isn't the only supplement that seniors take for brain health that can cause unexpected bleeding problems. Ginkgo supplements line pharmacy shelves with promises of sharper memory and mental clarity for aging minds. Ginkgo can have mild blood-thinning effects, and when combined with other blood thinners, it may raise bleeding risks. Always check with your doctor before adding ginkgo to your routine. Health stores market ginkgo as brain food for seniors. They promise better memory, clearer thinking, and protection against cognitive decline. But here's what they're not telling you. Some studies note ginkgo's potential to reduce platelet activity, so seniors on other anticoagulants should be extra cautious. Your aging body already struggles with blood clotting. Adding ginkgo to the mix can create bleeding risks that happen without warning. The compounds in ginkgo work like natural blood thinners in your system. They interfere with platelets, the tiny cells that help your blood clot when you get injured. When you take ginkgo regularly, these compounds build up and make your blood thinner. This becomes concerning when combined with medications seniors commonly take. Even a daily aspirin becomes riskier when mixed with ginkgo. The combination can cause bleeding that your body struggles to control. Your blood clotting system naturally weakens as you age. Your platelets don't work as well. Your blood vessels become more fragile. When you add ginkgo to aging bodies that already have compromised clotting, you create conditions for uncontrolled bleeding. What might cause minor bruising in younger people can cause more serious hemorrhages in seniors. There have been occasional reports of increased bleeding during surgery among ginkgo users. Surgeons often ask patients to pause these supplements before operations. Seniors who take ginkgo and undergo surgery may face higher risks of excessive bleeding during and after their procedures. The bleeding can form dangerous blood clots called hematomas. Wounds heal slower. Some patients need emergency blood transfusions. Ginkgo interacts with medications most seniors take daily. Ibuprofen for arthritis pain becomes a bleeding risk when combined with ginkgo. Prescription blood thinners like warfarin or clopidogrel become unpredictably powerful. Even blood pressure medications can increase bleeding risk when ginkgo is in your system. These interactions happen gradually, making them hard to notice until serious bleeding occurs. The hidden danger is that ginkgo can cause bleeding anywhere in your body without obvious symptoms. Brain bleeding might start with mild headaches that gradually worsen. Eye bleeding can begin with blurred vision. Stomach bleeding often starts with fatigue and weakness that people blame on normal aging. By the time symptoms become severe enough to seek help, the bleeding may have caused permanent damage. Evidence on memory benefits is mixed, so weigh those claims against the possible bleeding risk. Meanwhile, the bleeding risks are well documented with numerous case reports of seniors ending up in emergency rooms. Several countries have issued warnings or restrictions on ginkgo supplements specifically because of safety concerns for older adults. But bleeding isn't the only way popular herbs can disrupt your body's delicate systems as you age. Sage appears in health stores as nature's answer to menopause symptoms and memory problems. Sage contains compounds that may act like estrogen. If you have hormone-sensitive conditions or take thyroid or hormone therapies, discuss sage with your doctor before trying any supplements. Sage contains powerful plant compounds that act like hormones in your body. These compounds don't just provide gentle relief. They actually disrupt the delicate hormone balance that your aging body works hard to maintain. When you're over 65, your hormone system is already fragile. Adding sage compounds can push it into chaos. The estrogen-like effects of sage create serious dangers for seniors with certain health conditions. If you've had breast cancer, ovarian cancer, or endometrial cancer, sage can potentially trigger cancer cell growth. These hormone-sensitive cancers can start growing again when exposed to estrogen-like compounds. Even if you're cancer-free, sage can stimulate tissues in ways that increase future cancer risk. Sage might affect thyroid medication absorption, so monitor your thyroid labs if you add sage supplements. Your thyroid controls your metabolism, heart rate, and energy levels. When sage disrupts how your body processes thyroid medication, your thyroid hormone levels can become unpredictable. You might feel exhausted one day and jittery the next. Your heart rate can become irregular. These fluctuations are especially dangerous for seniors whose hearts are already working harder. Sage may lower blood sugar, which can compound diabetic medications and lead to dizziness or low sugar episodes. This sounds good, but it becomes dangerous when combined with diabetes medications. Your blood sugar can drop too low without warning. Hypoglycemia causes confusion, dizziness, and fainting. For seniors, this often leads to falls that can cause serious injuries. If you take hormone replacement therapy, adding sage creates a dangerous combination. The two sources of hormone-like compounds can overwhelm your system. You might experience severe mood swings, irregular bleeding, or dangerous blood clots. The interaction can make your prescribed hormones work too strongly or interfere with their effectiveness completely. While small culinary uses are usually safe, high-dose sage extracts could upset hormone balance in seniors. Use caution and seek medical advice before taking concentrated sage products. These concentrated forms contain levels of active compounds that can overwhelm your system. Even small amounts can cause dangerous reactions in aging bodies. If you notice new confusion, heart palpitations, or unusual fatigue after starting sage supplements, consider stopping and consulting your physician. These symptoms develop gradually, making the connection to sage difficult to recognize. The hormone disruption caused by sage can take months to reverse after you stop taking it. The pattern becomes clear when you look at all these herbs together. Each one marketed as completely safe, yet each one capable of causing serious harm to seniors who trust the marketing claims. The natural health industry makes billions by selling you hope while hiding these dangerous truths. They profit when you believe natural equals safe. Meanwhile, seniors end up in emergency rooms with bleeding, organ damage, and dangerous drug interactions. Supplement marketers often highlight benefits but downplay risks, so always look for balanced information. Before adding any herbal remedy, peppermint, moringa, green tea, ginkgo, or sage, check in with your doctor, especially if you take prescription medications. Be skeptical when someone promises miracle cures. Your medications and health conditions make you more vulnerable to these hidden dangers. Have you ever discussed herbal supplements with your healthcare provider? Share your experience in the comments to help fellow seniors. Staying informed empowers you to enjoy natural remedies safely and confidently.